Welcome. In this video we are going to analyze a very common example of aligner treatment. The problem here is crowding, especially the crowding on the lower arch. It happens very often when adult patients visit their hygienists with dental plaque and calculus problems. The common location is the lingual site of the lower incisors. One reason for this is the glandular ducts openings, and another reason is the aforementioned crowding, which makes brushing complicated. That is why aligning these teeth is of utter importance. At the same time, lower incisors crowding is not as often noticed as the upper incisors crowding. It is not seen when talking or smiling and doesn't bear a strong aesthetic component. Let us look at the lower arch. We can see the crowding and also the teeth rotations and dispositions. One thing to consider with the lower arch treatment is that the lower teeth are limited by the upper arch. So they are characterized by the space deficit, which you can see from the side as well. That is why in this case it is useful to consider IPR, and you might want to discuss it with your patient as well. As you can see here, the IPR volume and locations are defined by the Exceed lab, and using that we create the needed space for correcting the crowding and aligning the teeth. Now we are going to see the treatment plan and the movements. As you can see, we widen the arch and align the teeth, correcting the rotations and putting them back into the arch. We don't produce too much of protrusion or bodily movements, as you can see from the side, and that is nice considering the bone limitations. You can see it from the right side as well. And if we go back on the occlusal view, we see how the teeth actually move and how the space is created. One more thing to consider is the so-called black triangles. It is the situation we can observe if the teeth shape is closer to a triangle. In this case, when aligned, the incisors may form the dark spaces at the gingiva level. It also happens because the incisor papilla atrophy, and the solution here is additional IPR and better proximal contacts in the frontal region. All in all, this looks a very nice example of aligner treatment. The total treatment time here is 17 for the upper and 32 aligners for the lower arch. And the treatment time is nice, the result is good with a comfortable treatment.